Hello everybody. In this video we'll be speaking about spleen and we'll be discussing about the gross anatomy of spleen in a nutshell. So we should be aware of the fact that spleen is the largest hemolymphoid organ in the body. Spleen is the largest hemolymphoid organ in the body. Also there are two words which are related to spleen, that is splen and line. Splen is derived from Greek and line is derived from Latin. So later in the video we'll be speaking about something known as the lino-renal ligament. There the word lino refers to the spleen. Okay. Now talking about some general characteristics of spleen, we all must be knowing the functions of spleen. First being to manufacture RBCs in fetal life, and then it also provides immunity to the body by producing IgM, that is immunoglobulin M. Then it helps to store RBC and releases them into circulation as and when required, and also helps in filtering out blood by destroying worn out and old RBCs. Like RBCs after completing their 120 days of lifespan get worn out or get destroyed in the spleen. Therefore, spleen is also known as the graveyard of RBCs. Spleen is also known as the graveyard of RBCs. Now, talking about the location of spleen. Now, where is spleen exactly located? You might now already know that our abdomen is divided into 9 regions. So this is the anterior superior iliac spine that I'm making. This is the pubic symphysis. This is the pubic crest. This is the pubic tubercle. This is the inguinal ligament. This is the umbilicus out here. Now, if I make a horizontal line here, passing through L1 lumbar, this is the first lumbar vertebra. This is known as the transpyloric plane, also known as the Addison's plane. Also known as the Addison's plane. Now, if I draw another line here at the level of fifth lumbar vertebra, this is known as the transtubercular plane. Now, if I draw two vertical lines on either side, which pass through the midpoint of the clavicle, these two are referred to as the mid-clavicular line. So as you can see, the abdomen is now divided into 9 regions. 1, 2, 3, 4, 5, 6, 7, 8, 9 regions. Okay, each of these regions have got a separate name. To start with, this point or this region of the abdomen is known as the epigastric region or the epigastrium. Epigastric region or the epigastrium. This region is known as or the hypochondrium. This is also known as the hypochondrium. Like these two are left and right hypochondrium respectively. This is known as the umbilical region. These two are known as the left and right lumbar regions, because they correspond to the kidney, so that is why known as the lumbar region. This is known as the hypogastric region or the hypogastrium. The word hypo means below, right? And the word epi means above. So epigastrium, hypogastrium. Either side we have the right and left iliac fossa. Now, where does the spleen lie? The spleen lies in the left hypochondriac region or the left hypochondrium. Spleen lies in the left hypochondrium. Remember that. As we have already talked about the fact that the spleen lies in the left hypochondrium. Now, with respect to the ribs, where does the spleen lie? The spleen lies between the 9th and the 11th left rib, along the long axis of left 10th rib, making an angle of 45 degrees with the horizontal, and it extends up to the mid axillary line. I will be showing you a picture also here, wherein you will be able to appreciate the fact that the spleen lies between the 9th and the 11th left rib along the long axis of the left 10th rib, and it extends up to the mid axillary line. Also, if we talk about the dimensions or the measurements of spleen, you need to remember the odd numbers like 1, 3, 5 and 7. All these are in inches, this is in ounces. Spleen is 1 inch thick, 3 inches broad, 5 inches in length, and weighs 7 ounces. That is the weight. It weighs 7 ounces. Okay. Now, as you can see, here we have a collection of odd numbers, that is 1, 3, 5 and 7. And we also know the spleen lies between the 9th and the 11th left rib. So we also have 9 and 11 here. So can you appreciate a collection of odd numbers here? Yes. So this is what is known as the Harris's dictum of odd numbers. Known as the Harris's dictum of odd numbers. What are these? Harris's dictum of odd numbers is nothing but a collection of odd numbers which defines some splenic statistics, that is its thickness, its breadth, its length, weight and its extent. Now let's come to the most important part pertaining to anatomy of the spleen, is the external features, external or the gross features of spleen. Now if I draw a rough diagram of spleen here, Okay, now talking about the external features, the spleen has got 2 ends, 2 surfaces and 3 borders. 2 ends, 2 surfaces and 3 borders. So let's begin with ends. There are 2 ends of the spleen, as you can see, one being the posterior end and the other being the anterior end. Okay, now but there are 2 more names to each of these ends. Now for this you should understand, spleen is placed obliquely in our body. Like if I'm looking at the spleen from the inner aspect, the position of the spleen will be somewhat like this. Its orientation is oblique. That means the posterior end that you see here will be raised upwards, whereas the anterior portion that you see here, or the anterior end that you see here, would be lower than the posterior end. So by that logic, anterior end will also be known as the inferior end and posterior end will also be known as the superior end. Also, the posterior or the superior end is closer to the midline than the anterior end. Therefore, it is also known as the medial end. And this is also known as the lateral end. Medial, posterior, superior end and the anterior, inferior, lateral end. You will be able to appreciate all this in a cadaver. So whenever you attend your dissection classes, which you should never miss, make sure you understand the anatomy of spleen very well. Now we have seen the ends, the first end being the posterior, superior or medial end, second end being the anterior, inferior or lateral end. So ends are done. Now talking about surfaces. Now we have got 2 surfaces in spleen, one which faces inwards. This is the surface that you are seeing. The surface which you are looking at is the surface which is facing inwards. This is known as the visceral surface, because it is facing the other viscera or the hollow organs, right? So it is known as the visceral surface. Now talking about the other surface which faces outwards, it is known as the diaphragmatic surface. It's known as the diaphragmatic surface. It faces outwards. It faces the ribs actually. Now when we are done with surfaces, now let's start with borders. There are 3 important borders. This border that you see here, it is known as the superior border. It is known as the superior border. This border that you see, it is known as the inferior border. It is known as the inferior border. And the border that you see in between, it is known as the intermediate border. It is known as the intermediate border. Now, intermediate border is also known as margo intermedia. It is known as margo intermedia. This border is extremely important. Now you may ask why. Because it corresponds to the hilum of the spleen. Now what is the hilum of the spleen? If you have learned thorax by now, you are familiar with the hilum of the lung, right? What is the hilum of a lung? It is a short, broad pedicle which basically connects the medial surface of the lung to the mediastinum. And in simple terms, it is a place where all the contents enter the lung and exit the lung, isn't it? So basically, hilum of the spleen is also that area where all the vessels and the ligaments enter the spleen. Okay, they're related to the spleen at that very point. This is the hilum of the spleen. Okay, so that is why the margo intermedia or the intermediate border is very important. Now let's talk about some impressions. Like we are done with end surfaces and borders now. So let's talk about some impressions. Now spleen basically has 3 plus 1 impressions. Why did I write it like that? Because 3 impressions are always present. 3 impressions are always present. Now 1 impression may or may not be present. May or may not be present. Now talking about these impressions. The first impression is known as, okay, let me use a different page for it. Okay, now we are talking about the impressions. We are talking about the impressions on spleen. The first impression is the gastric impression. Now, where is this gastric impression located on spleen? This is the gastric impression. Where does it lie? It lies between the superior border and the intermediate border. Now, this impression is basically formed by the fundus of the stomach. The fundus of the stomach. Like if this is the spleen, this is the superior border of the spleen, and this being the intermediate border of spleen. And this is my stomach, and this is the fundus of the stomach. So the fundus of the stomach is related to the gastric impression like this. So that is why it forms an impression on the upper aspect, that is between the superior and the intermediate border. Therefore, it is known as the gastric impression. Now, the second impression is the renal impression. As the name suggests, it is by the kidney. Which kidney? By the left kidney. Because the spleen lies in the left side, right? So, this is the renal impression. The kidney lies, the left kidney makes an impression on the left kidney makes an impression on the inferior aspect or the visceral surface of the spleen. This is known as a renal impression, to be precise, by the left kidney. Now, where is it actually located? Between the intermediate border and the inferior border. Now, again, if this is your spleen, this is the intermediate border, and this is the inferior border, and this is the kidney. So, kidney making an impression here. So, this is the renal impression. This was the gastric impression for the fundus of the stomach. Now, there is a third impression known as the colic impression. Now, colic impression, this is present here. This is your colic impression. Now, what is the colic impression formed by? Now, if you know the structure of the large intestine, this is a very rough diagram. Now, if I make it here, there is no space here. This is a cecum, this is an ascending colon, this is a transverse colon, this is a descending colon, this is a sigmoid colon, and then we have the rectum here. Now, these two things that you see here, these are known as colic flexures. Colic flex, this is towards the right, this is towards the left. So, which organ comes over here? And there is a massive organ here, which is known as the liver. So this flexure, that is the right colic flexure, is also known as the hepatic flexure, whereas the left colic flexure is also known as the splenic flexure, because this is what is related to the spleen, and it forms a colic impression on the anterior surface of the visceral surface of the spleen. Here we have the colic impression. Now we also talked about another impression which may or may not be present in spleen, which it is known as the pancreatic impression. Known as the pancreatic impression. If present, it is found here, just near the colic impression. This is known as the pancreatic impression. This is where the tail of the pancreas comes